Next we have Dr. Muhsina T, and she'll be talking on a pathogenesis of primary angle closure disease, the role of crystalline lens, and observational study.
Good morning. My study topic was pathogenesis of primary angle closure disease, the role of crystalline lens. Why the topic is relevant? Glaucoma is the second most leading cause for blindness in the world, and in these 75% of the cases go undiagnosed, and it can be largely prevented through timely identification, appropriate treatment, and regular monitoring. And coming to the role of crystalline lens in the PACD, potential mechanism of primary angle closure disease is based on the biometric characteristic of anterior segment. In these, the crystalline lens has a crucial role in the progression of the disease. And now we have imaging modalities like KSOS2024 and optical A-scan biometries. Those are non-invasive methods to determine the role of crystalline lens in the pathogenesis of the disease. And my study aimed to assess the role of crystalline lens in the pathogenesis of primary angle closure disease using KSOS2024 and A-scan biometry. It is done as a case control study at ComTrust Charitable Trust Eye Hospital during a time frame of 6 months from June 2023 to November 2023 in a population of 150 eyes with PACD, primary angle closure disease, and 150 normal age-matched control group. The inclusion criteria based on the ICGO classification for primary angle closure disease in the age group between 40 to 70 years. For controls, we choose normal persons with no shallow AC and normal gonioscopy in the same age group. Exclusion done any patient with the secondary angle closure disease or any corneal or iris pathologies, or patient with significant cataract also excluded, and with patients taken any meiotic or mydriatic medications prior to the examination also excluded, and patient undergone laser PI before also excluded, and controls we excluded any kind of glaucoma and with the patient with a significant cataract. We done methodology. Consent obtained and detailed patient history and examination was done. All basic ophthalmologic evaluation done, including applanation tonometry, gonioscopy, and HFA 24-2, and also ASOCT and IOL master biometry done all of the patients and control, and we measured lens vault, anterior chamber depth, lens thickness, and all from this investigation. It's a demonstration of ASOCT image of anterior segment. We measured lens vault, anterior chamber depth from the ASOCT, and lens thickness and axial length from the IOL master biometry. Coming to the results, we got a significant huge difference between the case and control group in lens vault comparison, and also we determine lens age. Lens vault is increased in the increase in age. And also relative lens vault, there is a huge difference between the case and control group. Relative lens vault measured as lens vault divided by anterior vault. Anterior vault also, there is a statistically significant difference between the case and control group, and lens thickness also, there is a statistically significant difference between the case and PACD group. And also with increase in age, lens thickness increases. Relative lens position, which is measured as lens thickness plus anterior chamber depth plus half of lens thickness divided by axial length, also had a significant difference between the case and control group. Lens axial factor also measured, which is measured as lens thickness divided by axial length into 10, which also has a significant difference between the case and PACD group. Axial length, there was almost similar in both the case group and control group. Coming to conclusion, according to our study, we concluded crystalline lens has a significant contribution to primary angle closure disease pathogenesis, and in these parameters, lens vault and relative lens vault had a significant difference between the case and control group, and there are also other risk factors like older age, female gender, and shorter eyeball and shallow AC depth to the pathogenesis of the disease. And limitation of our study was the age was 40 to 70 years similar in both case and control, but in control group there are more younger individuals. And PACD patient recruitment, the subgroup was also distribution was a little bit unequal. And also we can't include the acute angle closure disease patient. They all examined after the medical management of acute rise of IOP, but not before laser PI. Recommendation, according to our study, we recommend some ASOCT and A-scan biometry in all patients with the gonioscopy, closed gonioscopy, and recommend early cataract extraction in patient with the significant lens fault and anterior lens position. And thank you.
So it's a good presentation. So ASOCT is a must know. So will all the institutes have ASOCT to measure?
If we
Where was this done? Contrast hospital. Okay. So do you use it regularly?
No, madam. We suspect a lens factor to the pathogenesis of disease. If we done gonioscopy, we doing gonioscopy
Scopy.
prior. If it is suspecting more lens-related factor, we can do ASOCT if we're suspecting.
How will you know from gonioscopy whether there's lens related? Okay, when we remove the lens, the AC will become deeper. I'm just asking.
With the patient with the some early cataract closed.
Actually, it's a good thought. It's a good study. Okay.
Can do for everything, then you with a bigger number you will get a control conclusion with a control set. Thank you.
With primary angle closure disease, you include all the stages or not? What? You are told primary disease. It includes what? Everything is included there.